Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. The supine knee to chest stretch can be performed single leg or double leg. This is a basic low back stretch. You want to be supine on the floor or on a sturdy table. Flex the knees towards the chest and reach behind the thighs, and you could grab the posterior thigh, or you can interlace your hands together and hold your hand or wrist behind the thigh. Some people like to do this stretch holding the front of the upper shin. I think that puts a little bit too much pressure on the knees, so I always recommend that you reach behind the thigh. Now, while performing the stretch, you always want to keep your head and your shoulder blades on the floor. And what you're going to do is just slowly pull the knees towards your chest. And if you can, you want to lift the back of the pelvis off the floor. You're going to move into the stretch slowly and hold a mild, comfortable stretch in the low back. You can hold this stretch anywhere from 10 seconds to 120 seconds, and then move out of the stretch slowly. And you could also perform it single leg. Same technique applies. Reach behind the thigh. You can interlace your fingers behind the thigh. Don't go behind the knee, go behind the thigh and pull the knee towards the chest on the side of the leg that you are holding. This will help to stretch the low back muscles and the gluteal muscles. And then move out of the stretch slowly. And then again, perform it on the opposite side. Even if you only have symptoms on one side, you still want to stretch both sides. Move into the stretch slowly. Hold a mild, comfortable stretch, anywhere from 10 to 120 seconds, and then move out of the stretch slowly. I'm going to demonstrate it again with the double leg. Bring the knees towards the chest. Wrap your hands around your thighs. Keep your head and shoulder blades contacting the floor. And pull the knees towards your chest, lifting the back part of the pelvis off the floor. This will help to stretch the lumbar spine muscles. The lumbar spine is the medical name for the low back. Move into the stretch slowly. Hold a mild, comfortable stretch for anywhere between 10 and 120 seconds, and then move out of the stretch slowly. Never perform any type of stretch or exercise that elicits or intensifies symptoms. If an exercise elicits or intensifies symptoms, stop immediately and find a viable substitute. When performing this stretch or any other type of stretch, always check with your medical professional to make sure that this is a proper stretch for you. Again, this is Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada, and I was describing and demonstrating the supine knees to chest stretch. Thank you everybody for watching today's video on spine health. Always remember, never perform an exercise that elicits or intensifies symptoms. Always work through a symptom-free range of motion. Always check with a medical professional before starting any type of exercise program. Please feel free to like, comment, and subscribe. You can visit my website, championshipchiropractic.com, where you get information on my book titled Running, Maximize Performance and Minimize Injuries. And you could also find my blog on my website. My blog contains articles on spine health, sports medicine, chiropractic, health, fitness, and nutrition. Thank you again for watching today's video. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada.